I'd like to present my poster entitled A Clinical Care Guideline for Sleep-Disordered Breathing in Patients with Myelomeningocele in the NICU. The clinical problem stems from inconsistent practices noted for patients with myelomeningocele who had apnea, bradycardia, and desaturation events in the neonatal intensive care unit, also known as the NICU. I'll transition here to calling these events to sleep-disordered breathing, a general term to describe breathing difficulties during sleep. In the NICU, there are different diagnostic tools, treatments, and monitoring after discharge for patients who have these events. The purpose was to standardize the approach to screening for sleep-disordered breathing in patients with myelomeningocele in the NICU at a freestanding, urban, academically affiliated children's hospital. The objectives were to establish an interprofessional team to analyze the available evidence to date and best practices to screen for sleep-disordered breathing in patients with myelomeningocele, to develop a clinical care guideline to screen for sleep-disordered breathing during the initial inpatient hospitalization, and to obtain approval of the clinical care guideline for clinical use in the NICU. Looking at the literature, there was increased incidence of sleep-disordered breathing among neonates and infants with myelomeningocele. There was no difference in symptoms of sleep-disordered breathing between patients who had fetal closure versus postnatal closure of the myelomeningocele. The literature recommended assessment for sleep-disordered breathing after birth and long-term follow-up of patients with myelomeningocele. The framework that guided the development of the project was knowledge to action. The measures for this project were approval of the clinical care guideline for use in the NICU and posting of the clinical care guideline on the NICU clinical pathway. The intervention for the project was to develop a clinical care guideline to screen for sleep-disordered breathing in patients with myelomeningocele in the NICU. The team evaluated the literature, the Spina Bifida Association's guidelines on the care of people with spina bifida, and other centers' practices. The clinical care guideline was then drafted and finalized. It was implemented into practice on October 6, 2025. The clinical care guideline recommends a polysomnogram or sleep study for all patients with myelomeningocele or myeloschisis and a Chiari-2 malformation during their initial inpatient hospitalization. The clinical care guideline has since been posted on the already existing NICU clinical pathway. The clinical care guideline made a practice change to obtain sleep studies on all patients in the NICU with myelomeningocele and a Chiari-2 malformation. The team will evaluate this guideline 1 year after implementation. There is also long-term implications that need to be evaluated as patients age. Thank you very much.